a regular market day in Zambia. A joyful, uplifting atmosphere. But a few blocks away, the challenges people in many sub-Saharan countries face become apparent. In this public hospital, the Ministry of Health is conducting a vaccination campaign for pregnant women. As people wait and doctors struggle, they experience firsthand the shortcomings of the health sector.
Low pay, low facilitation, lack of equipment.
In some hospitals, you have stockouts of medicines, while others don't have medicines. So that tells you that there is a problem in the system.
Corruption or any malpractices, they do deprive the people on access to health care. And this can lead to wrong treatments being administered. And worse still, the poor are normally affected quite more.
Transparency International is a non-profit that leads the global fight against corruption. As part of its efforts to improve public health services, it undertook research in communities across Zambia and Uganda. During this meeting, medical supplies are discussed. It is one component of the study, Transparency and Integrity in Service Delivery in Africa, or TISDA for short.
And the aim of the study was to identify leakages in the health sector under the building blocks, which include human resource, financing, information, accountability, transparency.
The study found that because of weak oversight mechanisms, poor financial records, and poor governance, the underfunded health sector has been stuck in a dangerous rut. One result is the lack of medicines and essential medical supplies.
The levels have been showing for the previous years, showing availability of averaging about 50%, which means that 50% of the time there are no essential medicines in our government sector.
Worse still, Transparency International found virtually no records on prescriptions or distribution of medicines. As a consequence, much is leaked and sold on the black market. This is clearly a form of corruption, with some medical staff abusing their position for personal gain. But lack of medicines is just one problem troubling the health services.
The hospital, when you go there, when you don't meet their doctors, you feel it badly.
Sarah is a local businesswoman. She is plagued by chronic migraines. When the pain strikes, her only option is a 30-minute walk to the town's small health facility. When she arrives, the hospital is packed with patients. She'll be waiting for hours.
I've come to the health center for medicine, but I met there so many sick people, and I found there one doctor. That is the problem.
The one doctor's name is Godfrey Sawande. He does his best to help Sarah and the other patients, but he's simply overwhelmed by the task. To cope, he desperately needs more colleagues, he says.
We would be having at least two clinical officers at the unit, but currently I'm one since I came.
By law, a minimum of 2 doctors should be present at a Class 3 health center like Dr. Sewandi's. Transparency International found that in Uganda and Zambia, staffing levels are at a mere 50% of what they should be. At the same time, salaries for the health workers that are employed are low.
We saw from the research that this was an increasingly overriding problem in the health sector, in that the workload that remains on the few existing health workers is quite enormous.
Many health workers are frustrated. They often face a choice between treating patients financial record keeping, or medicine allocation. So resources are poorly accounted for and health workers poorly paid. The risk of leakages or corruption is high. Transparency International analyzed these problems. It concluded that improving governance can fix many shortcomings.
Because of poor governance, and that has been defined using several domains, poor transparency, lack of accountability, low participation or low effective participation of the intended recipients, poor regulation of the health sector. So all of those things have tended to undermine the quality of service.
Information is very key in the health sector, and there should be a very good link, information flow and information sharing between the people, the public, and the health centers.
We have been able to set up district working groups, which we are calling district health community notice boards. And we believe that through that level of engagement, then the clients will also be engaged at another level.
In a small village in Zambia, one of the community organizations Transparency International set up to improve the exchange of information is having its first meeting. It unites all stakeholders, users, government, and providers. They discuss health problems in the area. Initiatives like the community boards can help drive governance reform. What's necessary is that all actors in the health field work together. That is one of Transparency International's main aims.
Transparency International will provide a platform for these particular stakeholders where they will be able to have a constructive engagement through dialogue.
And the stakeholders, including the public, the government, and all other people who are interested and organizations interested.
Governments have to ensure everyone plays by the rules and provide predictable and transparent funding. Users have to be engaged and play a constructive role, and providers have to be accountable and transparent. If all these parts are in place, reliable health services will become a reality.